Thanks, Hazel, for your question, which is, are there any hospitals that do this, colonics, for very sick patients who can't safely mess with anything outside of a hospital? Now, let me take you back to the 1940s. In the 1940s, 1930s, you could go to a doctor's office, and obviously there was no NHS and you would have to pay for it, but you would be able to have a colonic at doctor's office that was available there. And doctors were trained on it. But nowadays, obviously, that's not an option. You can't go into the doctors and have it done. In hospitals, they used to do enemas for women about to give birth, so that when they actually bed down, they wouldn't have a poo at the same time. That isn't done anymore because the hospital just says, we'll just get rid of the rubbish as it comes out. And I've got several midwives that are clients, and they use the same Inco pads that we do just to help deal with any mess. Funnily enough, they get the mess, but we don't here. But I had a patient of mine who was admitted into hospital for something unrelated to his bowel, but then he was in there for a couple of weeks, didn't go to the loo, his blood pressure was rising. They were talking about they were going to have to actually take his bowel out because he was so distended and so full. They were filling him with laxatives, that wasn't working, and they weren't offering him anything else like a little enema or anything like that because they didn't actually offer it. They didn't do it, and it would have really helped him. So in the end, after several phone calls with myself and with his specialist, I was allowed to go into the hospital and actually do that process for him using bedpans, oil and water. So it wasn't the lovely clean procedure that we have in the clinic where everything's in a tube. It was all a bit of outside. There was no tubing, but it did start him moving, which was really good. So they then cancelled his operation to have his bowel removed, which was a good thing. That's the one and only time I've ever been allowed into a hospital to do a process or a procedure for them, and they actually had the crash cart standing by, which I think was a little bit of an overkill, but there you go. But they just don't seem to do processes like that anymore. They rely on drugs so to try and make everything happen, which of course it doesn't always. So the answer is not really. There may be the odd place where maybe the doctors or the nurses have decided it's appropriate for them to do it in a particular unit that I don't know about, but as a rule of thumb, it's not really done under the NHS at all now, unfortunately. So I'm sorry about that. My question to you, I guess, would be that if you're very sick, would it be a good idea to be having a colonic or an enema anyway? I don't know, obviously, the reasons why, but if we have a patient that's ill, we actually won't treat them if they've got various illnesses. If there's there's a whole list, but if they've got particular illnesses, then it would be inappropriate, it would be contraindicated to do a colonic for them anyway. But so the long answer was there. The short answer is no. If you've listened this far, I hope that helps anyway.